Good afternoon, everyone. Thank you for watching our live update for Tuesday, January 26th. It's good to be back with you. I had to travel for a few days for a family obligation. So then when I returned, I had to work from home while in quarantine and wait to get a negative test result so that I could come back to work. Today I'm going to have some updates for you. Then I'll be followed by Anita, Adkins, who will provide you some more information on what I will share. And then Kathleen, Pender will join us to share some exciting information about an upcoming project that she has. Whitney, Woodruff has an announcement. And then David Curtis from Pastoral Care is here today to provide our Pastoral Care segment. First, let me give you today's COVID-19 update. On Friday last week, we learned that a Parsons Health Center third-floor resident had tested positive for COVID-19 and was subsequently moved to the COVID-positive unit. And along the same lines, one of the residents who was being cared for in the COVID unit has since recovered and returned to their apartment. So currently, we have 4 residents being cared for in the COVID-19 unit. The third floor of Parsons will remain in quarantine, which means that the hallway doors are closed and staff are wearing all the appropriate PPE when they enter anyone's room. They'll stay that way through Thursday, February 4th. I'm really pleased to report that Gables and Monticello's quarantine period ended on Saturday, January 23rd. So we're really good news. That's really good news that they're out of quarantine and can now move about in their apartment areas more freely. In other good news, our test results have come back over the weekend and didn't reveal any new staff or resident cases. And so that's really a hopeful time for us. Several of our employees who had tested positive previously have recovered and returned to work. And this week, it's been great the last couple days to see those folks back to work again. Currently, we only have 3 staff that are out in quarantine recovering off campus. And so that's really good news. We're finally starting to get our workforce back, and that's something we've been working on a long time. Now, for the vaccination update, I want to share with you some news regarding the vaccination process. I know, because I hear from a lot of you, and I've spoken to a lot of you, you're following the news about the vaccine very closely. And you're likely aware that there are some severe supply challenges with the vaccine that are affecting communities all around the U.S. The demand for the vaccine skyrocketed in every state as the vaccination process got implemented and with clinics and partnerships. The governors got involved and started pushing vaccine to a lot of new and different communities. And so said simply today, there just aren't enough doses to ramp up vaccination to the levels that everybody had hoped and that the federal governments and state governments said they would. At this point in time, it's not a human resource problem, it's a vaccination supply problem. There are people and systems available to administer the vaccine, but states and localities are having a hard time getting it. As you know, there have been several starts and stops at the local level, at the statewide level, and at the national level. Yesterday and today has been our second vaccination clinic with CVS to have staff and residents of Parsons Health Center get their second dose. You'll recall they got their first dose 3 weeks ago. And so yesterday, 233 employees and 117 residents in Parsons received their second doses. And today, assisted living is getting their first dose. So we're very grateful that our Parsons Health Center residents, our assisted living residents, and staff have gotten vaccinated. Those assisted living residents and any employees who receive their first doses today will receive their second dose on either February 15th or 16th. Now for the challenges. I'm sharing this information with you today after speaking to your resident executive committee, sharing some news and getting their guidance on how and what to share. But I'm going to share a lot of information, and Anita Adkins is going to follow behind me and add even more specifics to that information. I'm going to try to go slow, and I'm going to try to explain, because I realize some of this could get kind of confusing. On Thursday, I'll be back, and others will be back to help provide even more clarity to the situation. So now, let's talk about this independent living vaccination process. Through the federal Centers for Disease Control program called the Long-Term Care Vaccinations Program, CVS and Walgreens were contracted and authorized to provide vaccination for skilled nursing facilities and assisted livings. CVS and Walgreens were never authorized to vaccinate residents in independent living, purely limited by contract to skilled nursing and assisted living. As we all know, as the program was implemented, most all continuing care retirement communities around Virginia and around much of the U.S., especially those that are smaller than what Westminster Canterbury Richmond is, were able to get all of their residents and staff at all levels of care vaccinated through this partnership program, despite the fact that independent living were never contracted and were never supposed to be vaccinated through this program. Westminster Canterbury Richmond, myself, Will Blackwell, Sloan Verlander, others, were truthful and transparent about our resident and staff counts and our different levels of care in every conversation we had with CVS. And we've been advocating aggressively that our independent living residents need to be included in this partnership vaccination program. As we'd previously shared, CVS had informed us that they would be beginning our independent living vaccinations on February 15th and 16th, and that's what we'd shared with you. However, over the weekend and yesterday, with really no warning, CVS notified us that they canceled their agreement to vaccinate our independent living residents. I want to repeat that. So yesterday, we were informed by CVS that they have canceled our independent living vaccination clinics scheduled for February 15th and 16th. The fact that CVS would do this is a disgrace, and they should be ashamed of their decision. We are aware of only one other CCRC in Virginia that's in the same situation that we are. Now I know personally of other clinics that are being canceled in independent living by CVS in other states outside of Virginia. But to my knowledge, to our knowledge, there's only two here in Virginia, us and one other. This news is frustrating and it's extremely disappointing. I've heard from some of you, and I know you're going to be shocked and disappointed to hear this news. We are too. Our team, and I speak for a number of us who've been involved, have been working night and day on working through the vaccination details to make sure everybody got what they deserved. So I know you're feeling the same way I am. We're furious, we're frustrated. But I promise you we are not done working to find a solution for you. I want you to know that we have been and will continue to advocate to get these vaccination clinics here with all of our energies. A group of us, myself and a number of us, have been contacting directly every known avenue for vaccination that we know of. Largely, we're hearing the same message over and over, that the supply of vaccine is really limited. Many of the pharmacies who had some now have none. Many of the physician clinics that had some now don't have any. But they'll get more, and we're going to work to make sure that that those clinics are available to us when they reopen. A number of us have been in contact with the state and with CVS and with Walgreens and with our national leaders in Washington, D.C. and our state representatives And there's a lot of frustration at every level. And so we're going to continue to push. Many providers are waiting and that will get some, and they're hoping that their supply allocations of vaccine will be increased in the coming weeks. A group of us, have additional calls scheduled today and tomorrow where we hope that we might be able to find a couple other possible partnerships with organizations that currently have the ability to do some clinic. At this time, we have no confidence that CVS will fulfill their obligation to Westminster Canterbury, and CVS has not worked with us in good faith. And that's a sad fact. It's a disgrace, frankly. I know all of you are sitting there right now asking yourselves, how and why has this happened? I honestly don't know the answer because I can't get a straight answer. But I will share with you the facts that I know for sure. And as I said at the first fact, and I know this, and I've known this for a long time, CVS and Walgreens were never contracted to provide vaccination for independent living residents. Yet, as I said, they did in nearly all CCRCs in Virginia. CVS and Walgreens, this is fact number 2, CVS and Walgreens have been told by the governors of the U.S., to end the federal long-term care vaccination program by the end of February, meaning that all doses need to be administered by basically the 1st of February. So there's a timeline that they have to get the program terminated by. My sense is, and this is opinion, my sense is that the governors want control of the program. So quite honestly, they can direct some or much of the vaccine to other groups. Because of the time constraint, some first dose clinics that would have happened after this date, like ours, have been canceled. The remaining vaccination needs for communities like ours are going to be transitioned from CVS and Walgreens to state and local health departments. Now, you all know Dr. Danny Avula. He's been here twice and spoken to you. And he's one of my primary contact points when we have questions and concerns and need advocacy. And sadly for us, Danny has moved on to a new role at the state level. And so he now has pointed us to a new leader in charge of the vaccination process at the Henrico Richmond Health Department. Her name is Amy Popovich. Now, I've spoken to Amy a couple times, others have too, and she's made it clear Henrico and Richmond are receiving, the Henrico Richmond Health Department is receiving about 6,500 doses a week. And Henrico and Richmond Health Department, they'll be essentially in charge of vaccinating independent living communities like Westminster Canterbury if and when we do mass clinic, some kind of a mass clinic. She also shared that in the Henrico Richmond Health District, there are 51 independent living communities like Westminster Canterbury, but standalone independent living communities that need to be vaccinated. So I can't stand here and tell you how long it's going to take for them to get to us. The health department has made it clear that they plan to start this vaccination process in independent living within the next week. And so that's good news. They have some vaccine and they are beginning the process soon. They've also shared that they will be using resident age and outbreak data to determine where their clinics will start, where they'll go first, if you will. Now, good news or bad news, we're an older community, and so that might help us have a little bit of priority. However, you, the residents, your families, our staff, have done a really good job of working with an abundance of caution to keep each other well and have managed to avoid an outbreak in our independent living areas, which is to be celebrated. And the Virginia Department of Health local Henrico office said we should be celebrating that. But this means we're not going to be the first to get vaccinated because they're going to go to areas where the track record isn't as good. And so that's frustrating, but at the same time, it's understandable. And there are communities that are really suffering with active cases. And so we don't get to decide where they go first. We will partner with them, and we will do all we can to get them here as quickly as we can. But at the end of the day, they're going to Virginia Department of Health is going to determine where they start and how that line plays out. We do hope to have some other partnerships, including other pharmacies and large health systems, and we're working on that actively. But as you can imagine, they are also working with or dealing with vaccine scarcity and huge demand. Everyone wants it and no one has it. Now, a number of you have asked, who should I call? Who should I write? Who should I complain to? Given where we are in the process and that this is transitioning to the Virginia Department of Health, the Henrico and Richmond Office of the Public Health, my opinion is the best place to advocate for access to the vaccine is through our local and state representatives. Senator Jennifer McClellan and Delegate Lamont Bagby would be two good places, two good individuals to reach out to say, we deserve it and we need to have it as soon as they can make it available. And if they can help us with these large health systems or pharmacies get in here and get it done, that would be helpful. We're doing the same. We've also reached out to our national leadership and state leadership. We'll put more of that information, the contact information for our senators and delegate in the live update summary. Now, in the meantime, there are some options where you can attempt to pursue vaccination outside Westminster Canterbury, outside the process that Anita's will outline for us. I know, we know, that some of you, maybe many of you, have turned down other opportunities to get vaccinated, deciding to wait until the February 15th and 16th vaccination clinics here at Westminster Canterbury. I am truly sorry. Like I said, what CVS has done to this community is shameful. I wish I could go back, change things, but we trusted that CVS would follow through on their obligation and deal with us in good faith, and they've let us down. Our resident services team, Deborah, social workers, others, is working on a process that will help each and every resident who has not yet been vaccinated to get signed up for every possible vaccination clinic outside of Westminster Canterbury. And if that opportunity becomes available before we can get it in here, we will get you there, we will take care of it, and we'll get you back here. We'll have more details to share with you on Thursday at the live update about that and other things. And we will provide it to you in writing in the next couple of days as well. Again, I want to say I'm really sorry to have to share this news, and I share your frustration. We all do. And so let me turn it over to Anita now, Anita Adkins now. She will share with you some of the process that we're going to go through to get you access to these other opportunities. There are 3 or 4 channels that we know where vaccinations are happening, and we're going to help you get signed up for those with the hope that maybe you can get into those before we can get somebody here to help us out. So goodbye for now. I'll see you on Thursday. Thank you.
Well, as John said, we do continue to work on ways for our independent living residents to receive the vaccine sooner, but I'm going to walk through a few suggestions for you. So this information is going to be available in writing via the live update summary that will come out later this afternoon on our blog and via Touchtown. And if you don't use those channels, you will receive something printed and in writing in the coming days. So I'm going to be sharing some phone numbers and other information with you, so you may want to grab a pen and paper and jot some of this down if you want it sooner. So as John said, Resident Services is developing a process to help every independent living resident be registered in the appropriate places. We're setting up a separate phone extension that you'll be able to call to get assistance, especially if you don't use email or use the internet. So we will be tracking who receives the vaccine outside of Westminster Canterbury. We do ask for your patience. We know that you're going to have questions, but please give us a little time to finalize the process, and then Deborah will be back on Thursday with the details, and you'll receive them in writing in Friday's update memo. So we still encourage you to get a vaccine off-site if possible. And while the uncertain vaccine supply affects all of the providers in our area, we do know that everyone remains committed to vaccinating as quickly as possible as the supplies are available. Please check with your primary care physician, or if you were contacted by a reputable outside source like your doctor's office or a hospital, please take advantage of scheduling an appointment with them. If you need a transportation to get to a vaccine appointment, you may call our transportation department at extension 6263 to schedule an appointment to get you to your vaccine appointment. Now, for veterans who live in independent living, you may qualify to get your COVID-19 vaccination through the Veterans Health Administration. You must be in the Richmond VA Medical Center computer system to be eligible for the vaccine. But you can call to check and see if you're eligible. So to check your eligibility, call 804-675-6660. And once you confirm your eligibility, you can then call to register for a vaccine appointment. And the number for that is 804-675-5000. Once you call that number, you can press 0 to speak to someone without waiting through the prompts. We also understand that VCU Health has begun vaccinating existing patients who received care at one of their hospitals or clinics in the past 3 years and that meet the state's Phase 1B requirements, so those ages 65 and older would qualify. They are starting with their oldest patients first. So if you have been a patient at VCU Health within the past 3 years, you may be contacted directly to make a vaccination appointment, or you may call 804-360-4669. And we'll also share a website where you can go to read more about their process. If you're a current Bon Secours medical group patient, you can also call the Bon Secours COVID-19 vaccination hotline. It's available Monday through Friday between 8 a.m. and 5 p.m. And to schedule your appointment or to get additional information about the locations that are offering the vaccine, there is a number you can call. And that number is 866-624-0366. And again, we'll share the website where you can read more about that. And then finally, we also encourage you to sign up through a form on the Henrico County Health Department website. There's a 65-plus interest form where you can enter your information, and the team at Henrico County Health Department will call you to schedule an appointment. Now, we don't know how quickly those appointments will be available, but they are prioritizing by age and beginning with the oldest people who have filled out the form. So we'll put a link and instructions in today's live update summary, but you go to their website, click on the age 65 plus interest form, and select the option for 65 plus years of age, not currently a resident in a long-term care facility, and then fill out the form with your contact information. And if you don't use the internet, this is one of the options that Resident Services will be available to help you with soon through the process that we'll be explaining later this week. Now, the clinic here at Westminster Canterbury wants you to know that if you are an independent living resident and you are vaccinated outside of Westminster Canterbury, please notify the clinic so that your medical record can be updated. And the clinic will need more than just a phone call saying that you've been vaccinated. They'll actually need a copy of your vaccine documentation. Finally, we do encourage you to pursue these options with these reputable organizations in Richmond while we're continuing to work toward getting a clinic here on site as soon as we can. But we also want you to be aware of any potential scams related to vaccination. So please make sure you avoid any options or contacts that may include one of these following things. If you're asked to pay out of pocket to get the vaccine, or if you're asked to pay to put your name on a vaccine waiting list or to get early access. Avoid advertisements for vaccines that come through social media platforms, email, telephone calls, online, or from unsolicited or unknown sources. Avoid marketers who are offering to sell or ship doses of the vaccine for payment. And just in general, make sure you protect yourself and don't give your personal information to unknown sources. Make sure you rely on the reputable organizations you already know. So this is a lot of information. Please remember that these live updates replay on TV 971 and the digital signs daily at 10 a.m., 2 p.m., and 6 p.m. You can also watch the video or read the summary on the blog or Touchtown community apps. And as we said, we'll be back in touch this week with additional information and updates as we pursue every opportunity we can find on your behalf. Changing topics, I have one other quick announcement. Tom Henning was here last week and announced some changes coming to the Tower laundry rooms. We want you to know that Tower residents will be receiving a memo with more information in their boxes, and Tom will be back with us on Thursday with an update. And with that, I'll turn it over to Kathleen Pender. Thank you.
Good afternoon. I'd like to share with you an upcoming project that will be taking place outside of the tower, specifically the Tower Island located nearest the Spiritual Center Island. We anticipate beginning the Tower Island renovation project the week of February 1st, 2021. This project includes the enhancement of the Center Tower Island in parking lot 4 and 5 and the Center Tower Island in parking lot 2 and 3, with the small island in Tower parking lot 2. The first phase of the project will begin with the Center Island located in parking lot 4 and 5. Nearest the Spiritual Center the week of February 1. The existing large stone in the island will be removed and replaced with brick pavers complementary to those that have recently been installed at the West Tower entrance and the Tower Green. This will provide pedestrians in this lot a safe, level space to walk to their cars. In the middle of the islands, a series of tree wells will be dug for shade trees to be installed to help provide greenery and shade in the parking lot. In preparation for this project to start, we will need to temporarily stage materials in the parking spaces at the end of the space in the center of the island, closest to Westbrook Avenue. We will also be taking a few spaces at the bottom of the lot, so as you see cones and caution tape out, please be aware. In addition, we will be roping off the first 2 feet of each parking space in the center of the island to create a safety work zone for the contractors to safely perform their work. Lastly, we will need to temporarily block at minimum the 2 spaces on each end of the island closest to the tower building on the Brown Garden side to allow for a new concrete ramp installation for the entry point of the island. We anticipate this phase of the project to take about 2 weeks for completion. Additional information and updates will be provided via TV 970, the Tails, and K4. Thank you in advance for your understanding as we work to enhance this area for our residents. Should you have any questions, please contact myself, Kathleen Pender, at kpender@wcrichmond.org or extension 6045. Next up, Whitney Woodruff.
Good afternoon, everybody. I am here to tell you a little bit about the butterflies that you may have seen around campus. So you may have seen these floating along the walls of our halls here at Westminster Canterbury. And in case you're wondering about them, they are from a group called Butterflies for Smiles. Butterflies for Smiles is a Precious COVID pop-up group. It's a mission-based group with local children who wanted to make these coffee filter and clothespin butterflies to bring smiles to the seniors who are suffering through the pandemic or feeling a little bit isolated. So they have made these all summer, spring, winter, fall. They've been making them all year long, and they brought 1,000 of them to Westminster Canterbury for us to enjoy and for us to share with Guardian Place, which is another community that we would often volunteer at prior to COVID. So they are adorning the walls, and I hope you've seen them. I hope they've brought you smiles, because they've brought a lot of the employees smiles as we're walking through. And what we're going to do is we're going to leave these up on the walls for the next 2 to 3 weeks. And then right around Valentine's Day, we're going to have our residents take 1 or 2 of them off to take home with you so they can make you smile in your apartment as well. So a big thanks to Butterflies for Smiles. A big thanks to Sarah Abernathy and Rebecca Hatch for posting these or putting them up around campus. So we're hoping you enjoy them, and we'll look forward to when you can take a couple of them home with you. So happy butterflies, and up next is David Curtis.
Good afternoon. I'm David Curtis, one of the staff chaplains here at Westminster Canterbury. A few pastoral care updates for you. Please join us this Thursday, January the 28th at 10:30 a.m. on TV 970 for our weekly worship. The Reverend Jenny Tavelda will preach, and Susie Frazier will provide the music for our worship. The February prayer booklets will be available by the end of the week. If you have received one previously, you will receive another one automatically in your box. If you have not received one previously and would like one, please contact Vanessa Perry at extension 1502, or you can call me at extension 5179. The prayer booklets provide a weekly rhythm of prayer, and these booklets also contain the Thursday worship bulletins. These prayer booklets are updated monthly. And finally, tomorrow, January the 27th, is International Holocaust Remembrance Day. Tomorrow is the 76th anniversary of the liberation of Auschwitz-Birkenau, the largest Nazi concentration and death camp, by the Russian army. Tomorrow is set aside to remember the millions lost to anti-Semitism. We also remember those killed because of their national origin, or disabilities, or faith tradition, or political leanings, or sexual orientation. And I invite you to remember those lost as I offer this poem, written by Malka B., a child survivor of the Holocaust. I have lived, dear God, in a world gone mad, and I have seen evil unleashed beyond reason or understanding. I was with them. We drank from the same bitter cup. I hid with them, feared with them, struggled with them. And when the killing was finally done, I had survived while millions had died. I do not know why. I have asked many questions for which there are no answers, and I have even cursed my life, thinking I could not endure the pain. but a flame inside me refused to die. I could not throw away what had been ripped away from so many. In the end, I had to choose life. I had to struggle to cross the bridge between the dead and the living. I had to rebuild what had been destroyed. I had to deny death another victory. May the memory of those lost in the Holocaust be for us a blessing. The news that John also gave us this afternoon is hard news for us to hear. Some may be upset and some may be angry, and perhaps many will be disappointed. And as always, the Pastoral Care Department is here to support you, to listen to you, and to pray with you. The holy story of the holy people of God tells about waiting, the waiting to return to the promised land, the waiting to return from exile in Babylon, the waiting for the coming of the Messiah, the waiting for the resurrection, and the waiting for the second coming of Christ. We wait, and we wait, and we wait. And yet God waits with God's people always. Hear these words from Isaiah chapter 40, verses 28 through 31. Have you not known? Have you not heard? The Lord is the everlasting God, the creator of the ends of the earth. He does not faint or grow weary. His understanding is unsearchable. He gives power to the faint and strengthens the powerless. Even youths will faint and be weary, and the young will fall exhausted. But those who wait for the Lord shall renew their strength. They shall mount up with wings like eagles. They shall run and not be weary. They shall walk and not faint. The word of the Lord. Thanks be to God. Let us pray. Loving God, giver of grace and comfort, be with us as we walk these days. Be with us in our joys and in our frustrations, in our hopes and in our disappointments. Be with us as we wait, and be with us as we rejoice. Walk with your holy people as you walked through the cool of the evening in the garden, as you walked through the heat of the desert, as you walked to the foot of Calvary. Remind us that you were here, that you never leave, that you are from everlasting to everlasting. Amen. Please join us Thursday afternoon at 3 p.m. for our next video update.